Hi everyone, I'm Dr. Diane Hayden, publisher of Natural Nutmeg magazine, and welcome to our weekly podcast where I interview our expert writers and contributors on topics ranging from natural medicine, nutrition, green living, fitness, nutrition, and how to live a healthier, more holistic lifestyle. I'm excited to have with me today April Beaman. She is a medical thermographer certified by the Professional Academy of Clinical Thermology. She's a professional member of Breast Thermography International, and she has worked in the wellness industry for over 15 years and provides thermography screenings and wellness support for both men and women. She's the owner of CT Thermography located in Farmington, and we'll be talking today about her article that's coming up in our July issue on what you should know about dense breasts and mammography. So thank you so much for being with us today, April. How are you?
I'm doing awesome. Thank you. Thank you so much for having me. I always love these podcasts. There's so much information and they're so valuable.
Yeah, me too. Me too. We get into a lot of fun stuff, which we're going to be getting into today. I love this topic because I think that there is so much misinformation out there, and really just not enough information about thermography and what it is and why men and women should consider doing that in addition to, or even maybe versus some of the more traditional tests like mammography. So, um, where do you want to start? I mean, I was thinking maybe, I know you have some pictures to show us. And when I read the title, dense breasts, I don't know if you want to start here, but I know that one of my questions was, what does that really mean? Like when you hear that, when you go get your mammogram and you hear, somebody says that to you or whatever, I always think like, and I've actually had somebody say to me, "Oh, it's because my, like I work out a lot and my chest is more muscular." But I don't think that's what that really means.
You're absolutely right. And you know what? Most women don't know about dense breast. And if they know that they have dense breast, the only reason why they know is because they've had a mammogram, because it is an X-ray finding. It's a radiologist that's going to determine the density of your breast. And really what it just means is that your tissue appears different on the X-ray if you have dense breast tissue. So it really has nothing to do with the way your breasts look or feel. They don't feel harder, they're not bigger, they're not lumpier or bumpier, because that's cystic breast. That's a whole different animal to deal with breast. But the density really is just looking at the different tissues within the mammogram. And that's what that means.
Right. And I think, when I read your article and you showed me the picture that you're going to show, that really, like that picture to me was like, well, I mean, I got it when I was reading the article in terms of how difficult it is to detect cancer in women who do have dense breasts. But when you showed the picture, I was like, oh, wow. Like looking at that, to me, if that was me, I would be like, you're wasting your time if you're getting mammograms, and especially if you're getting them every year. My belief is that the radiation does cause issues. Do we know if it actually potentially causes cancer? I don't know if we've ever been able to prove that, but my personal philosophy is, why add to more insult to the body than you have to when there's other things like thermography that you can do. And I had an amazing experience with you. We actually, we did a podcast. If anyone missed it, it's on our website. You can search for the podcast that we did where we actually looked at my thermogram, and people who are, new to it can, get pretty much, they'll, we take you through the whole experience. It's
Yeah.
amazing. It's non-invasive. It's great. I loved it. And I think it's a great tool. And I think, everyone should be doing that first. And then if anything comes up on that, then go to the more invasive types of testing. That's just my philosophy.
Well, I will tell you that studies have shown the effectiveness of mammography, if you are a woman with dense breast tissue, decreases immensely, which means basically they can't see anything, so they can't do a thorough screening for you. So, like you mentioned, it's one of those things that, why am I having a mammogram if I have dense tissue? And the dense tissue is going to obscure things. The nice thing is now there's a law that's been passed since 2009. 38 states have it in as a law that they have to note in your mammogram if you have dense breast, because before that, women had no idea.
Wow.
And there isn't a lot of verbiage in terms of what it is. but it will say that having dense breasts can obscure masses and potentially hide cancer. So at least that information is there for women. And I would say if your mammogram report doesn't have that, and if you also don't get a letter after your mammogram stating that for you, because again, Connecticut, that law is in effect in Connecticut, then talk to your healthcare provider because they have that information and they should be talking to you anyway. You know, typically most women, you know, they realize that when they have dense tissue that the doctors are going to, or the radiologist or the report is going to say, okay, you have to have additional screening. So an ultrasound is usually ordered after that. So that's another cue that you have dense breast, because ultrasound is giving another view of the breast so that they can at least help correlate the mammogram findings. So.
Yeah. Do you want to show that picture that you were showing to me that shows like just what did the breast look like on these screenings and how difficult it is to actually detect cancer on someone who has dense breasts?
Absolutely. Okay, so well, let's talk about the breast. So as you can see, this pictorial depiction of the breast is showing that this is kind of looking at it as a mammogram. So you have the muscle that's behind the breast, you have the breast itself, and then you have fat that's in between all of the granular tissue and the ducts. So the breasts are mainly made up of ducts, granular tissue, connective tissue, and fat. And when we're looking at it in terms of a mammogram, we can see that some of the areas are looking whiter and some areas are looking darker and some areas are looking gray. And as you might notice, the fattier area is the area that looks darker. So again, knowing that you have dense breasts doesn't mean that when you touch your breasts, they feel hard. It means that an X-ray is determining this for you. So you would only know that you have dense breast if you've had a mammogram prior. So let's talk about density. Now, there's categories of density, and this should also be listed on your mammogram report so you understand. It's category A, B, C, or D. So you can see category A is mostly entirely fatty. So there's a lot more grays and darker tones in this breast versus white, because dense tissue, which is typically the fibrous connective tissue or fibrogranuloma or finular granular tissue, is what is the density. So the density of that fibrous tissue is white. So if you have mostly fatty breast tissue, you don't have a lot of white that's obscuring the mammogram, because cancer, tumors, masses, they all look white too. So this is category A. It's mostly entirely fatty. And then we have scattered areas of fibrogranuloma, granular density, right? So you can see here that there's some white throughout the grays itself. And then you're starting to look more into the dense category, right? So we're looking at density here and extremely dense here. This is category C and D. So if you fall in category C or D, you are considered dense. And look at the difference between the two images here. So we have fatty, extremely dense, extremely white. So again, the difference is fattier tissue is dark on an X-ray, dark or dark gray, whereas dense tissue, which is more fibrous tissue, more connective tissue, is white. So the next image.
And just one quick question.
Yes.
Did you say that women with dense breasts are at a greater risk of breast cancer?
Well,
Or
I haven't said that yet.
Oh, okay.
But I
You're
will
going to get
tell.
to that.
Well, you know, as we're kind of talking about it, so we can go back. So I will tell you that 50% of women under the age of 50 have dense breast tissue. So that's half of all women. And as we age, typically your density changes. So usually age, as you increase in age and after menopause, usually the breast becomes fattier. So, but with that being said, if you are somebody that has extremely dense tissue, category D, you will never go from extremely dense to entirely fatty. It will change, but it won't change all the way. So it does change. So, I mean, we're looking at 50% of women, 40%, which really fall into that dense category too, as well. So The issue is that as many studies that have been done with this, they do see that having dense breast can increase your chances of breast cancer. They're not really sure why that is, but first of all, there is, depending on where the cancer would be formed, if it's in this area of extreme dense tissue, they can't see it. So it could be obscured and just missed over time. And they're not sure what exactly causes that. More so, is it the ducts? And that's what's getting more cancer. So unfortunately, it does increase your risk. Those women that have extremely breast dense tissue or just dense tissue are 4 times more likely to have breast cancer than women with a fattier breast tissue.
Mhm.
So it's pretty high.
Yep. But interestingly enough, what you're going to show us now is just the problems with trying to detect that on a mammogram and why these types of people should be getting thermography or, other ways of detection versus this, because this to me, what you're about to show was just amazing.
Yes. So what you're looking at is 2 different breast types. The breast type on the left is scattered, and the breast type on the right is dense or extremely dense. And really, what I like to talk about it is because we're looking for something in the breast that is dense, like a mass or a tumor or cancer. And if you have dense tissue, it completely obscures it. It's like looking for a snowball in a snowstorm. You just can't see it. And this video is really going to depict that. So if you're looking at the circle, it's circling over where there is an area of question, cancer. And if that goes over to the dense tissue, you cannot see that. It is completely masked. So if you were a radiologist looking at this x-ray, you would not be able to see that area that is white, which again is the density.
Yeah, that's just amazing.
Yeah. And remember, 50% of women have dense breast tissue.
Hmm. Yep.
But yet, mammograms are the standard of care and is what our practitioners are recommending for us
For now.
as being the best breast cancer screening.
Hmm.
And you touched on it in the beginning, right? We know that there are environmental factors that cause cancer. Most of our cancers, especially breast cancer, are relating to environmental factors, not even family history, not even having, a gene that is controlling, your breast health. It's really those environmental factors. So many things play a role with that, but we're utilizing a technology, X-ray, that uses radiation and ionizing radiation, which is one of the most harmful radiations to the body, that's cumulative. So it stays in the body and it stays in that very sensitive breast tissue. But yet we are screening our breast for cancer with something that could be known to cause cancer as an environmental factor.
Yeah, that's just crazy to me. And as we were talking before we started this, I was doing just a little bit of research this morning and coming across a couple of, basically what I Googled was, do mammograms cause breast cancer? And it was what came up was fascinating to me. Of course, obviously there's a million things that can come up from, the NIH and the CDC and Johns Hopkins and all these, great research institutions debunking that, saying, oh, of course not, it's perfectly safe, blah, blah, blah. But I'm looking for the other information, like, okay, let's see what else is out there. Like what other kinds of studies are coming out that maybe are supporting that question. So one of them that I found, I think it was the Journal of the Academy of Royal Science or something like that. I forget the exact journal name, but I was on PubMed, and this one researcher's finding was that breast cancer rates were actually increased in women that had regular mammograms. And his question that he was posing was, is mammography causing cancer, or are we detecting and doing invasive procedures for cancers that the body would normally eradicate itself? In other words, he's saying that these women are being overdiagnosed, overtreated, and so you're taking healthy women that may have, something that looks like a cancer, or even if it might be a stage 1, and they're doing all kinds of invasive procedures, and they're actually increasing their risk of death when there's the potential that your body may have just dealt with. I mean, we have cancer in our body all the time. Like, I don't know if a lot of people don't know that or don't understand that, but we have cancer in the body all the time. We have viruses in the body all the time. Our body is this amazing machine that fights this stuff off. So, I think what he was trying to get at was, there's too much over treatment essentially and over diagnosis. And he actually went on to make this statement, and he said the best thing a woman can do to lower her risk of becoming a breast cancer patient is to avoid mammography. And I realized that that is a very polarizing, like strong statement to make, but it was, and this was a study done in like 2015. So it's pretty, fairly recent.
Yeah.
And he showed all these other statistics in different countries where, countries like Denmark that don't do a lot of mammography, the breast cancer rates are down, whereas where it's countries that do a lot of mammography, like the US, our breast cancer rates are up.
Mm-hmm.
So, I mean, it's something to think about.
Well, what you touched on was very clear. And yes, this information has been out there that a lot of women are being overdiagnosed and overtreated for cancers they don't even have. And then let's not just let's even go to the point of the fear factor of it, right? So you go in, you have a mammogram, okay, they see something. And ultimately they call you at 5:58 on a Friday. So, you can't talk to anybody, you don't
Of
have your
course.
report. And it's just one of those things that you're like, okay, now you are just stressing over the weekend about it. And then they call you back in, they do an ultrasound. Okay, well, we still think we see something. Then they biopsy it, which is invasive to the body. And then they put a titanium chip, a metal marker into the breast so they know where they biopsied. So future mammograms can detect that. And then what's that saying? How is your breast going to be affected by that titanium marker that's in there? And then it turns out to be nothing. But yet the cortisol levels and the stress from that, and then
Mhm.
every subsequent time you have a mammogram, you're thinking about that completely.
Yep.
You're always thinking about it. So
Right. The psychological harm of false positives.
correct. And then, of course, then we can go the opposite route of false negatives, right? Just because your mammogram says negative or benign when you leave doesn't mean you don't have cancer. Doesn't just means that maybe it's not large enough that they can detect it, or they can't see it because you have dense tissue.
Right.
So that's a huge thing. Again,
Yep.
that's why that law was passed about having dense tissue and making women aware that they do, and that additional screenings will more likely be needed to correlate the findings. Now, the wonderful thing about thermography, it's not affected by dense tissue because we're looking at the physiological changes in the breast, the blood flow, the heat, the inflammation, the vascularity in the breast. So having dense tissue has nothing to do with thermography. Again, this is an X-ray finding because mammograms, ultrasounds, MRIs, they're looking for structure. They have to see something that's formed in the breast. And typically that's about the size of an eraser head before it's detected, regardless if you have dense tissue or not. And that size of a mass could take many years to grow, but yet physiological changes are happening in the breast as that's forming or prior to it forming. So it's a very different screening type. And of course, your readers are familiar, or those that watch the last podcast, that it's not invasive. There's no radiation. There's no compression. That's another thing that women are concerned with, right? Women with implants, having that compression of the implants that are there. Women that, maybe have something going on, and is that compression spreading cells
Mhm.
throughout the breast? So there's so many questions. And that's why really mammography has gone under scrutiny for many years for a
Right.
lot of reasons. There's a lot of research out there in terms of mammograms and not really helping. Sure, they've detected cancer earlier because what's happening is they're seeing these cancers possibly that would have never turned into anything, like you mentioned before. So the rate of cancer has gone up because of that too.
Yeah, exactly. I mean, like I said, in our other podcasts, my experience with you and with thermography was fantastic. It's great. I mean, basically, you're just standing in front of a camera, taking pictures of it. I mean, it's like you don't have to do anything. Just stand there.
You
No
have to be a
invasive.
little cold, that's it.
Yeah. Well, I mean, hey, you could go in July when it's hot out and it might actually be nice. So, which is about when this podcast will be airing. So we're coming up on hot weather. But yeah, and I think that, I'm always about what preventative measures can you take first before doing all this invasive stuff. And this is a great way to me, find out information that the mammogram's not going to give you. I mean, really, it's like, why do you want to wait until you detect something? You want to start now to see where you have inflammation in the body, where you have heat in the body. Where are what are these areas? What does this baseline or, multiple thermograms look like? What are things that are changing, and why do you have certain hot spots, so to speak, I call them, in the body? Like, what's going on there? That's stuff that happens probably years before cancer is developing. And it doesn't even mean that it's going to develop into cancer. It just means, okay, why is this happening? Could it be a hormonal thing? Could it be, um, who knows, diet? There's like a million things that are potentially causing inflammation. So
Absolutely.
let's find this out, and now we can address it so you don't go down that path of it turning into something.
Well, that's a very good point too. I mean, the big thing with inflammation is, first of all, on a thermogram, it shows up as heat, right? Because it is hot. But we know that inflammation is linked to diseases, and breast cancer is one of them. So what I like about thermography, and I became a medical thermographer because I was interested in looking at thermography for my own health. This started many years ago. And so I started doing research, like, what is it? What does it entail? How is it different than the other screenings that were offered? And what I really like, and a lot of my clients feel this way too, is it empowers them. Their thermogram empowers them because they can see things that they wouldn't be able to see otherwise throughout the body, that is going to take some work to improve if they want to be proactive with their health. And that's really what we should be. Our doctor and our medical system is reactive, right? You have something on your mammogram, it needs to be addressed now. But that something on your mammogram might not be cancer, but if it is, it's been growing for years before it's been detected. But yet our doctors only know how to, not all, but a lot of our doctors only know how to address something when it's already an issue. Why are we not talking about breast health and how we can improve breast health with lifestyle and dietary decisions and choices? That's huge. Vitamin D's levels, looking at hormones and balancing hormones. The majority of breast cancers are estrogen based, they're hormone based. So why are we not looking at that? And it could be something as simple as, listen, you're bringing in all this extra estrogen into your body, you need to stop that. So simple things that can be addressed. And let's not even talk about younger women. Why are we not looking at our breast health when we're younger versus we're waiting until we're 40 or 45, the age our doctors say, okay, now it's time to get your mammogram?
Yeah.
Why are we not looking at that? And I'm passionate about that because I had two girlfriends diagnosed with breast cancer in their early 30s. They both found their own lumps because they don't have any screenings that are available to them.
Right.
So if you're in your 30s and you don't have problems with your breast, then your doctors are never going to mention anything to you. But if you come and you're like, oh, I kind of have a little pain here, it's been happening for a couple months, maybe they'll recommend an ultrasound, but there's nothing that they're looking at in terms of what's going on now. And that's why that baseline, as you mentioned, is so important. Getting that baseline of your health. We
Yeah.
offer more than just breast thermography, but most people are familiar with breast thermography as thermography, but it's a wonderful tool for the whole body.
Oh, right, exactly. Well, I think the thing we're both kind of getting at is taking responsibility. Like looking at this from a preventative standpoint, not a reactive standpoint. And that is, like, for me, I mean, that theme keeps coming up, especially like after the last year that we've had, is like, hello, if you didn't wake up and realize that you need to take responsibility for your health after last year, I don't think you're ever going to wake up. But and it's realizing that, okay, your doctor is, yeah, your doctor's a great person, tons of experience, went through medical school. It doesn't mean they're the be all end all. And you need to be able to have a relationship with your doctor where you can say, I want to try something different, or I want to add this into what I'm doing for my treatment plan. And I'm specifically bringing this up because you touched on it in your article in terms of, I think many people are afraid to ask, especially women, we're afraid to ask for stuff, or, to go go against the mainstream or whatever, we're afraid to say to our OBGYN or primary care or whatever, like, I want to try this other, technique or whatever it might be, therapeutic, whatever it is. I mean, and I'm like, yeah, let's talk about this because I had that experience. My doctor kept saying to me, did you get your mammogram this year? Next year. Did you get your mammogram this year? I'm like, nope, not doing it. Nope, not doing it. Did it when I was in my early 40s. I'm not doing it again for 10 years. What do you mean? Like, you have to do it every year. No, I'm not doing it. She's like, well, I've got to read you the spiel to protect my butt. I'm like, go ahead and read it. Not doing it. But I'm the type of person that I guess I feel that strongly about it, that I just, stood up to her and was basically like, I mean, she wasn't pressuring me or anything like that, but it was this insistent yearly thing, to go get it, go get it, go get it. And I'm like, no, I'm not doing that. I'm going to go do thermography. And we got to a point where, she was like, okay, that's fine. Go do thermography. I'd love to see the report. I want to learn more about that anyway. And so, luckily I have a good relationship with this person. She's a doctor that I think is a little bit more open-minded, but like we were talking, we both were like, listen, if your doctor's not open to this stuff, you need to find a new doctor.
100%. 100%. And you know what? We are our greatest health advocates.
Mm-hmm.
So, and I always tell my clients too, and this was the same when I was in the dental profession. Listen, you need to interview your doctors. They're working for you. And if they are not in the same mindset as you, then it's like you said, it's time to move on. And I know sometimes that's hard because you've been seeing them for a long time and, maybe you're comfortable with them, but it is one of those things where you have to be on the same page about your health, in
I
general.
agree. I agree. And there's so many, resources out there. I mean, certainly anyone, pick up natural nutmeg and go through it and call like any of the practitioners in there and say, like, who would you recommend as a primary care or an OBGYN that you work with? Who better than to ask someone like yourself? I'm sure you've got great referrals, or a naturopath who obviously will know who are the traditional docs that are open and willing to learn and collaborate and work with you on this. So
Correct. That's huge.
definitely, definitely. So anything else that you want us to know about, just thermography or the topic we're talking about in terms of alternative to mammo? And
Well, what I want you to know is that if you're a woman who has dense breast tissue, or maybe you're not aware of it. So again, ask your practitioner, they'll give you that information if you've had a mammogram. But relying solely on mammography is not the ideal situation, especially with those women with dense tissue. And you can see just by those images, again, it's like looking for a snowball in a snowstorm. So leaving with having a negative mammogram does not necessarily mean that there isn't something that's there. It just might not be seen or can't be seen because it's masked by the tissue. There isn't a lot that you can do for having dense tissue. I mean, I recommend to my clients some self-care routines. And of course, I'm always recommending that they talk with their doctors for other things, know your vitamin D levels, look at some supplementation like selenium. There's some really great supplements that can be helpful for breast health. And sometimes just simply doing breast massage is so valuable to the breast tissue itself. Know that having dense tissue is not abnormal. It is not an abnormal finding. It's just the way that your breasts are built. So it's not like you have this bad thing going on. It's just that mammography is going to be less effective for you. So look at other screening types. And also be very aware of your breast, the way they feel. Do breast exams. I suggest that to all of my clients. There's women that do not touch their breast ever. It's just like this taboo thing. And that's not ideal. This is why I've created a breast oil that all of my clients receive in their new gift bag, because I want them to do a breast massage. I want them to do self-exams to be familiar with the way their tissue feels normally. So, because the majority of women actually find their own breast cancer before their mammograms do. So it's a good thing to know what your tissue feels like normally. So if something does feel different to you, you can alert your doctor to that.
mm-hmm,
And yourself, of course.
That's funny that you're like, I know some women who don't want to touch their breasts. I'm like, well, tell their partner to touch them and tell them, hey, is anything like up here.
Yeah, they'll be happy to do that for you. Actually, I have many of my clients, with the breast bomb, they're like, I have to buy more of this because my husband loves putting it on me.
That
So,
is
hey, listen,
classic.
I'm keeping marriages together too. I'm giving you
Exactly.
thermography screenings and I'm also keeping marriages together. So I could do it all.
That is so funny. Yeah, but it's true. Like, I mean, for whatever reason, people have like have that concern or whatever. They're like, oh, I've never done that before. Well, start doing it. Like there's a lot of things you've never done before. It doesn't mean you shouldn't start doing it. And yeah, I totally agree with you. Like a lot of the people that I know that have had breast cancer found it themselves for sure. So it's like, what are these mammals even doing for us? It's like,
That is the question.
right.
That's the $1 million question. Every woman wants to know. But like I said, the one thing is that that's what our doctors are most familiar with.
Yep.
So educate them on thermography or just say to them, I want to add thermography in. It is, because mammography is a standard of care, no other screening is a replacement. Of course, there are women that will never do mammograms again. So why should I not be offered another screening, such as a thermogram or
Mhm.
an ultrasound, things of that sort? And I'm a big advocate for a triangle of breast health, right? Making sure you're doing your self exams and making sure that you're using 2 screenings together, because there's not one screening that's 100% accurate. None of it is.
Mhm.
Because everybody's different, of course. Mammography at best is about 83% accurate. And if you have dense tissue, that decreases to about 20 to 40%. That's a huge drop.
Wow.
That means it's missing lots of things and is not effective. Thermography is at its highest 94% sensitive and accurate. And of course, everybody's different. It depends on the breast type, breast size, just like everything else. But again, density has no effect on thermography, which is a wonderful thing. So if you are someone that has dense tissue or that has had inconclusive mammograms, or you're young, or just anyone, you
Yeah.
should be using thermography. But those big things, inconclusive mammogram, which means they have no idea. So that's a big one. And dense tissue, if you're a category C or D, and even if you have the scattered tissue, it's still a higher risk because that cancer could be forming in that scattered tissue. The
Yeah.
only one that has that low risk of being able to see is the fatty tissue. And 10% of women have fatty tissue. Then we go to scattered, which is 40%. Then we go to dense, which is 40%. Then we go to extremely dense, which is 10%. So there's a big in between of the percent of women that have those tissue types.
Mhm. Yep. So what would you recommend for someone who didn't want to have mammograms? Would you recommend thermography and ultrasound?
Absolutely.
Okay.
Yeah, ultrasound is still looking at structure, right? So ultrasound is great at determining if there's something in the breast. And what I like about ultrasound too is that if the cysts sometimes will be questionable on a mammogram, and a lot of women have cystic breasts. That's one thing I briefly mentioned earlier, which is cyst pockets in the breast. Usually, most women are familiar with that because they have breast pain, tenderness, and it's usually around menstrual cycles that you feel it the most. But again, a lot of women have cystic breasts too. But when that wand for an ultrasound goes over the breast, if you have a cyst, it bounces, right? So it's kind of like squishy because it's liquid filled. So it's not this density. So ultrasound is great at determining if there's something in the breast. For the most part, okay, it looks like a cyst, that's what it is. And they'll measure it and then they'll monitor it. And those cysts come and go and sometimes go away and never come back, unless someone has very cystic breast. So utilizing the two together is great. That's personally what I do. I use thermography. I screen every 6 months, even though I'm on an annual screening right now. I screen every 6 months, and then I'll do an ultrasound, and that ultrasound will be annually.
Mhm. Okay. Awesome. So how can people learn more, get in touch with you, reach out to you, any contact information you want to give for us?
So you can always visit the website, ctthermography.com. There's tons of information on our website. I also have monthly thermography webinars where you can come and listen and see actual thermogram pictures so you can see what that looks like. And that's on our website too. And then of course you can always call. I love to talk to people. So you can always call if you have any questions, please feel free. I have lots of women that reach out to me. They're like, hey, I heard about thermography 5 years ago. And then I saw this, and then I saw you in natural nutmeg, and then they'll just reach out. And that's kind of the time it clicks to them. The big thing to know again is that be proactive with your breast health. Don't wait until something is there and then you react to it. You want to know what's going on now, and thermography can give you a detailed picture of your breast health right now.
Yeah, I love that. That's the theme, be proactive and preventative measures versus, waiting and then having to react to a situation. I think that's super important for people. Awesome. Well, thank you so much for all the great information and the fun pictures. And it's always fun to do a podcast with you for sure. We talk about a lot of cool stuff, and I think hopefully open people's minds to different modalities, and that just to know that these options are out there, and to have confidence in looking into them and talking to their doctor and choosing a different route if that's a better route for you, for sure. So I hope that people will reach out to you and learn more about you. And thank you again, April, for all your time today.
Thank you so much for having me and having these awesome podcasts. Appreciate it, Diane.
Awesome. Well, hope everybody enjoyed it, and hope everybody has a great day.